Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi, everyone. Tom Viola with Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, now we're going to be talking about the drugs used to treat neuropathic pain, neuropathy. Nobody wants neuropathy. And it's difficult to treat because we really need to find those drugs that can inhibit pain neurotransmitters in the central nervous system. You would think we might have a whole bevy of drugs at this point, but in reality we only have two. We have Neurontin, gabapentin. We have Lyrica, pregabalin. Now, Cymbalta, duloxetine, has also been used in managing neuropathies and certain types of chronic pain. Okay, what do these drugs do exactly? Well, we don't know. That's the thing. The mechanism of action is kind of shadowy, and basically we know they block pain transmission to the brain, but we're not really sure exactly how. Well, what are these drugs designed to do? What sort of conditions are they indicated for treating? Well, we do know, for example, that diabetic peripheral neuropathy may respond well to these drugs, as well as postherpetic neuralgia, the pain you get after you've had shingles. But fibromyalgia and conditions like it, and pains of unknown origin, myofascial pain, those are things that don't necessarily respond well to medications. And so patients have been using these drugs sometimes to no avail and sometimes to limited success. The issue with these drugs is that we don't have any better ones, and these are the drugs we're using for now. Now, what is it about these drugs that you need to know? Well, I could talk to you all day about the fact that these drugs cause sedation and fatigue. Ask anybody who's taken them and they'll tell you they do sort of take the pep out of your step. But they also cause xerostomia, which is, again, problematic for us. A patient who has neuropathy would probably be taking this drug long-term, and so they'd have a long-term xerostomia, and the older they get, the increased risk that would be for periodontal disease and so on. But the one thing that I think concerns a lot of us about gabapentin especially, and Lyrica is a close second, is that these drugs are somewhat addictive. And perhaps the most widely abused prescription drug in this country may be gabapentin. We won't know for sure why, because gabapentin in very high doses can cause an opioid-like effect. So it is a drug that's widely abused, but it doesn't show up on a urine screen as a drug of abuse. It shows up on a urine screen as gabapentin, which you could say you're taking for your neuropathy. And so cases of gabapentin abuse may go underreported. What type of patient care considerations do we need to worry about with these drugs? Well, muscular weakness for sure, poor motor coordination, and hold your head a certain way, turn towards me, keep your mouth open. These tasks may be difficult for patients taking these medications. And the potential, anyway, for a shift towards hostile behavior, mood swings, especially with Lyrica. Well, that's it for this edition of Fast Facts Pharmacology, folks. Tune in next time for the next edition, also dealing with central nervous system pharmacology. Until then, this is Tom Viola. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.